If there's two people in the same room, please turn down your microphones. We're about to go live. If there's Good morning, everyone, and welcome to our 2020 Leader to Leader Summit. We're going to now introduce you to our wonderful co-hosts. They are Akila Pryor and Jordan Sanders, and they will bring you all of the greetings and information. So we're ready for Akila and we're ready for John.
For these are all our children. We either pay for or profit by what they become. The late James Baldwin spoke these words decades ago, and his words will ring true today. The work that we accomplish today will benefit all of America's children. Good morning. I am Akila Pryor, a 9th grade student at Douglas Anderson School of the Arts, but more importantly, I am a star, a smart, talented, and resilient student in the I'm a Star Foundation. Last year, during our 2019 Leader to Leader Summit, I had the pleasure of serving as your co-host along with Jordan Brown, who was a senior. Jordan Brown is now in college, and I have the pleasure of sharing this platform again with another Jordan. This Jordan is a 6th grader, and I'll let him introduce himself.
Thank you, Akila. I am Jordan Sanders, a 6th grade student at Kirby Smith Middle School, and I am proud to be a solution-oriented, world-changing star. I am in the I'm a Star Foundation. Today, we are here to share issues and problems, but more importantly, we are here to create solutions. If you look across this Zoom, you will see at least 3 generations coming together to help America's children unleash their inner greatness.
During the 2019 Leader to Leader Summit, we tackled some starting statistics. 30% of America's teens reported to be bullied. 7.4 of America's teens actually committed suicide. 3.1 million of adolescents in the U.S. have depressive episodes, and 167 high school students were arrested each year. One area of concerns was bullying, crime, and transforming disadvantaged youth into leaders. The I'm a Star Foundation is pleased to share that our students took all of these solutions seriously, and we are working hard to tackle them all. Our coding team will explain this app that we're developing. Our YouTube podcast team will share our newly found YouTube and podcast, and let's begin with our coding team. Awesome.
Okay, coding team, can you start your PowerPoint?
Hello, my name is Javar Collier, and I will be representing the coding group. We have been meeting for the past couple of months designing the Empower Me app. Today, we will be presenting a PowerPoint on Empower Me app review. The members of the coding team are Knowledge Ellis, John Woodard, Joseph Dorsey, Valencia Gibson, Miles McLaughlin, and Gavin.
In 2019, student and adult leaders created solutions for bullying, crime, and student engagement. I'm a Star students took the suggestions and created 21st century solutions that are relevant to today's teens. With that in mind, we created the Empower Me app to encourage and empower students to take control of their attitudes and actions. The Empower Me app will be designed for middle and high school students and can be accessed via their phones, tablets, or computers. Our Empower Me app will provide daily inspirational quotes to encourage students to always be at their best, suggest physical exercise to stay healthy, have games to simulate bullying and effective ways to successfully overcome these situations, and provide resource information for users to receive help with bullying, suicide, obesity, and mental health issues.
The Empower Me app will be available for iPhone and Android mobile platforms. We will be making use of the program language of Dart, and our type of database will be MySQL. On the left side of the screen, you can also see an example of how the app will look.
The two main parts of a computer are hardware and software. Hardware is the physical things that you can touch. Software is what is inside the computer which you cannot touch. Examples of hardware include an iPhone, PlayStation, laptop, TV monitors, etc. Examples of software include video games, Microsoft Word, Instagram, Gmail, and Zoom.
Thank you.
Awesome. That app is going to save some lives. But we're going to go on to the YouTube team.
And we have a video presentation from our YouTube team, but we'll have a brief introduction from Ms. Lanaya White.
Hello, I'm Lanaya White, an 11th grader at H. Peterson. Yesterday, we made a presentation about what we have in store for our podcast and YouTube channel.
And here we go.
Hello, smart and talented stars. Our goal with the Reaching with the Stars podcast and YouTube channel is to empower young people across the entire world. We talk about the different and interesting things that go on in the world. Although we have CNN to talk about these different topics, we also have a voice, and we add just a little spice to make it fun and interesting. We always want to encourage people to use your powerful voice.
Knowing that times are a little rough, our podcast and YouTube channel not only provide facts, but empower, give encouragement, and give comfort.
Join us as we empower the youth and reach for the stars.
And remember, a loss is one step closer to a win because we are stars, smart, talented, and resilient. So never stop reaching with the stars.
Thank you, Akila.
Great work. I know that YouTube/podcast will be amazing.
Another item that came out of the 2019 Leader to Leader Summit is the development of star houses that I'm a Star will use to offer a safe place with teams who come after school. One of Amistar's biggest supporters, the Honorable Sam Newby, Vice President of the Jacksonville City Council, is helping us achieve our goals and will begin greetings at this time.
Yes, thank you. On behalf of Mayor Lenny Curry, City Council, with the Council President of Tom, Missouri, and the City of Jacksonville, I want to thank the Amistar Foundation for doing great work with our greatest assets, our kids. Also, I see one of my colleagues, Terrence Freeman, on the call. Also, he's another big supporter of Amistar and our youth. Also, Councilwoman Joyce Morgan will be on the call real soon, and that shows you the commitment that City Council have to Amistar and to our greatest asset, our kids. So thank you and God bless.
Jordan? Thank you, Councilman Newby. We were prepared to have the Honorable State Representative Tracy Davis to come in to give you greetings from the state of Florida. She's at another session. She will be in with us later, and then she will come and bring greetings. But we also have Councilman Terrence Freeman, who is a great supporter of the Amistar Foundation, who's actually helping the Amistar Foundation and 100 Black Men to get a youth center where we can offer our services. So we will have Councilman Freeman to bring us greetings at this time.
Yeah, good morning again, and thank you so much for inviting me. I'm Terrence Freeman, City Council member, Group 1 at large, and definitely a friend and strong supporter of the Amistar Foundation. As a former educator, I never can pass up an opportunity to be empowered and to be inspired by you, our leaders of not only tomorrow, but our leaders of today. So I'm looking forward to today's session and participating in any way that I can to add value to it. And Ms. Bernie has definitely let out the secret. I've done my best to try to sit on it, but the Teen Center is definitely coming out of the ground. She can attest, and so can Mr. King, that it has been a process, but you all are worth the fight, and we will never stop fighting for you. So you all keep doing your part, and I promise you we'll do ours. God bless you, and you guys have a great day.
Thank you.
Thank you, Mr. Freeman. And we will now have greetings from the national level. And as we will welcome United States Congressman Jim Clyburn, Minority Whip from the South Carolina. Please listen to this pre-recorded message for the Amistar students.
Thank you very much for allowing me to spend some time with you today. And thanks to my longtime friend, Alvin Brown, for inviting me. You know, those of you who watch us here in the Congress, you know we often refer to each other here as my good friend, but most times we don't mean it. I do mean it when I call Alvin Brown a good friend. He has been a very good friend for a long, long time. And I want to congratulate each and every one of you who are participating in the Star Foundation. You are training to be leaders. And I have one simple bit of advice for you. Leadership is as leadership does. So by that I mean, as my dad used to tell me, you must lead by precept and example. No matter what you may profess as leadership, it is what you practice. It is what you do. It's a little bit biblical. It's not their words, but their deeds that really matter. So remember, as you go about your duties and responsibilities and provide leadership for whomever you may come in contact with, it is always how you do it and what you do that really matters. Now let me sound one little warning to you. I know that sometimes you won't get it right. People do make mistakes. But what really makes a good leader is to be able to learn from those mistakes and do it right the next time. You remember what your grandparents told you, maybe your parents or your guardians. If at first you don't succeed, try and try again. They never said try one more time or two more times. No, they never place a numerical limit on how many times you should try. I currently serve, as many of you know, as the House Majority Leader, or whip. That is the number 3 position here in the United States House of Representatives. But the first time I ran for office, I lost. The second time I ran, I lost. And the third time I ran, I lost. And a friend of mine said to me, you know what they say, 3 strikes and you're out. What are you going to do now? I said to my friend, that is a baseball rule, that nobody should live their lives by baseball rules. So each and every one of you, remember, if you don't get it right the first time, try it again. And keep trying until you get it right. And remember this as you go through life. The first sign of a good, well-educated person is good manners. It will do as much for you as anything else that I know. So be a good leader, provide good leadership, but as you do, practice good manners. Thank you, and Godspeed to each and every one of you.
Thank you so much, Congressman Clyburn, for that very inspirational message. Today's summit has been planned by I'm a Star's leader. Today's event, the Leader to Leader Summit, was planned by an 8th grader from River City Science Academy, Kennedy Larkins. She serves as the team's chairperson and will now lay out today's program. Before
Kennedy comes to the forefront, I'd like to say that we also have national leadership that joins us each year, and that is Congressman John Rutherford's office. Mr. Chris Miller is here representing Congressman John Rutherford, and we're going to be asking him and Joyce Danford, who's our council person, the Honorable Joyce Danford, to bring greetings at the end. We also have Dana Krisnor, who is our deputy superintendent, and others that we will share. But I just wanted to make sure that everyone knew that we also had congressional leadership from Congressman Rutherford's office. Our superintendent is on the Zoom, also Superintendent Diana Green, Superintendent of the Year, Diana Green, as I might add. And but we will share that information as we go on. So I'm sorry, now we will bring Kennedy, our 8th grader, who actually put all of this together. Kennedy.
Good morning, everyone. On behalf of the Leader to Leader team, I would like to welcome each of you. Our team has put a lot of work into the summit to make it a success. I would like a few moments to introduce them. Milton Person, Elizabeth Shara Husband, Trinity Burney, Russell Will Robinson IV, Jordan Bell, Malachi White, Journey Butler, and Amira Horn. You'll meet our team members when you go into our breakout rooms. Today, we will discuss and find solutions to the issues impacting America's teens. COVID-19 vaccine, mental health and mindfulness, climate change, and racial equity and police relations. Each of you will participate in 2 45-minute breakout sessions. At noon, you will return into the main room for a wrap-up and a share of the solutions.
At this time, the I'm a Star's Executive Director will share the names of today's special guests. Following this list, all persons will be moved to the first breakout session.
Thank you so much, Akila. Before we share those names, and Mr. Hank Rogers will share several of the names with you if I happen to miss any. But when you go into the COVID-19 session, if anyone goes into that session, there is a poll that they want you to take before coming in. They want everyone on the Zoom to take this poll because they're talking about the COVID-19 vaccine. So I'm going to put up a quick anonymous poll, and it's only one question. And I'd just like for you to be able to answer that. And the poll that we're going to launch is for the COVID-19 vaccine. And it's simply, you will say, yes, I would take the vaccine, or no, I would not take the vaccine. I'm going to launch the poll, and I ask that you vote. Remember, it's anonymous. We just have a few more that need to log in, and we will have our results. The poll will close in a few seconds. Okay, I think that we are good. Valencia, who will be leading the session, Valencia, there is 56% who said no, they would not take the vaccine, and 46% who said yes, they would take the vaccine. So thank you all for registering that vote for us. Okay, it is my pleasure to just share just briefly a few of the individuals who are on with us, and then Mr. Hank Rogers will go through and provide you any information on anyone that I missed. I am just delighted that we have a friend from Johns Hopkins University who I'm a star and Dr. Lorene Husband has been conversing with, and that is Ann Palmer. Johns Hopkins University and the I'm a Star Foundation will team up to do some things, and we're actually, God willing, COVID gone, we'll try to get together with our group going to a major conference to be with Johns Hopkins University in September. We also, as I said, we have our Deputy Superintendent, Dana Krisner, who has been a wonderful friend of Star, the newly elected chairman of the Duval County School Board, Elizabeth Anderson. Of course, we have our wonderful superintendent, who is such a friend to I'm a Star. We're so happy to have her. I see that we have members from ESS, Mr. Anthony Chesnosky, and now I will turn it over to Mr. Hank Rogers for him to get anyone that I missed. There is someone that Miss Pinnock is on, but we're going to let her introduce herself at the appropriate time. But Mr. Rogers, do you have anyone that I missed? I want to make sure that we get everybody.
Good morning again to everyone on the call. Again, we have from the Times Union, we have Mr. John Reeves, from Coca-Cola Beverage of Florida, Mr. Travis A. Warner, Ms. Mary Kelly, Polkner with the Florida Times Union is also on the line. Ms. Valerie Feinberg from the Health Planning Council of Northeast Florida is also joining us today. Ms. Teresa Skepper, sorry, I'm pronouncing her name incorrectly, but she's also with the Florida Times Union. I believe we have everyone. Oh, we have a friend also from Farrah and Farrah, also joining us, Ms. Leeds.
Okay, thank you so much. If there's a guest and we could not see you because of the way that we're sharing and we can't see you on, could you please make sure that you send a message to me in the chat, because I want to acknowledge you. This is going to be an awesome opportunity. As Kennedy stated, the students have been working hard, and the groups that will lead are actually from the Leader to Leader team. We have several teams in our I'm a Star group. Everything is student led and student created. So we're getting ready to now go into our breakout rooms. When we go into our breakout rooms, I'm going to launch the information for the breakout rooms so that we can make sure that you get to the room that you want to go into. If, and please listen to this, if you want to be in the COVID session, do not click on a breakout room because the COVID session will be in the main room. If you want to be in mental health, racial equity, climate change, and we also have a press room so that the press can get information from Carla Jones, please click those on. I want to also acknowledge the presence of the 25th International Supreme Bachelors of Alpha Kappa Alpha Sorority, and that is Dr. Norma Solomon White. The members of Alpha Kappa Alpha Sorority does great things with the Amistar Foundation, and we're so happy to have you on. We also have a friend, and that is another friend from ESS that that we love, and that is Mr. Doug Snyder. So thank you so much. I'm getting ready now to launch the breakout rooms. You will let me know if you can't see the breakout rooms on the list, then you need to let me know. So please, if you want to go into whichever ones you want to go into, please click that room and go into those rooms. There's mental health mindfulness, racial equity, climate change, press room. Please feel free to click the breakout rooms now. If you have problems with those, I will be in the main room for anyone who does not have their app prepared to do that, and we will do it. We need some people going into climate change. We need some people to go into climate change. Now there are several that I guess you don't have the app yet, and I'll assign you to the rooms that you want to go in. Could all of our students, our student leaders, could you please go to your assigned rooms? Student leaders. So Ms. Kennebrew, you are assigned to racial equity. Dr. Jenkins, I will assign you to climate change. Okay, so the others of you, I'm assuming that you will be in the COVID-19 vaccine.
Ms. Betty, I didn't
Okay.
see breakout room options.
Okay, would you like to stay in the COVID-19 vaccine with us for right now?
Well, if I can go to, the racial inequity.
Okay.
Yeah.
Okay, I'll send you to the racial equity.
Okay.
Give me 1 second.
And Miss Betty, I would like to go to the racial inequity one as well, please.
Okay, and that is, and whose name is that? I'm trying to.
Millicent Leeds.
Okay, hi, how are you doing?
Good, how are you?
I'm doing great, thank you so much. Let me get you to racial equity. Is there anyone else on the Zoom now who in this room now? Journey, you need to go to your.
Ms. Bernie, we have Dr. Krisner who's requesting to go to climate change if she can.
Okay.
We have Chairwoman Anderson who's requesting to go to the mental health group if she can be a part of that.
Okay, give me 1 second. I need to get Journey Butler into climate change really quickly.
Ms. Barney.
Just one moment. Let me get to Dr. Krisner. Hi, Dr. Krisner. Dr. Krisner, which one did you want? Climate change?
That is correct, Ms. Bernie. She asked
Okay.
for climate change.
Okay, and then you said Chairwoman Anderson wanted?
The mental health.
Great.
Breakout.
Okay.
And then Councilman Freeman is requesting if he could go to the racial
equity. Let me just find his name here. Okay. All right.
And
Is there,
Ms. Bernie, this is Chris Miller. If I may also go to racial equity, I would appreciate it. Thank you.
okay, thank you. And Mr. Miller, will you be available to do remarks at the end?
Oh, absolutely. Thank
Okay,
you.
thank you. All right.
Ms. Byrne,
Yes.
can I also go to racial equity?
Okay. And then after that, I think we should have everybody. Is there anybody else? Okay, because we need to get started, let me get, okay, Demaya, and then we will get started in this room. Demaya, will you be taking notes in there?
Yes, ma'am.
Thank you. Okay. Now, all right, let's get started. So we will now have,
Real quick, Ms. Barney, you have a request, iOS _DMP. Not sure who that is, but they also are requesting to be sent to racial equity as well.
iOS.
If you hover over the screen, there should be join breakout rooms in the left-hand corner, in the upper left-hand corner.
Let me get the iOS and then we will.
I'm sorry, Miss Bernie, that might be me because I'm on my iPad. This is Diana Green.
Oh, okay. So you want the, Dr. Green, do you want to do the, you want to do the racial equity, you said?
Yes, ma'am.
Okay, thank you.
You're welcome.
All righty. Okay, so I think we have everybody. And hi, Mary Kelly Parker. It's so good to see you. Thank you. So
it is great to be here. Thanks for having me.
Awesome. We will get started. And our person in charge of, the COVID-19, Valencia Gibson, it's all on you. I will shut up.
My name is Valencia Gibson, and I am your facilitator for the COVID-19 vaccine breakout session. I would also like to recognize Cheryl Husband, Jordan Bell, and Malachi White, who are members of the Leader to Leader program. As of yesterday, 15,721,790 people in America were diagnosed with COVID-19. That is more people than live in the entire country of Zimbabwe. Can you imagine that? Also, as of yesterday, 293,633 people in America have died of COVID. Picture this. That is like having everybody who lives in the city of Orlando, Florida, die tomorrow. All of these people who died have names. All of these people who died have families and loved ones. These are our fellow Americans. According to an article in the Washington Post, only about 100 children have died from COVID-19. So here's why I am concerned. Those 100 children were precious to their parents, their families, their classmates, their friends, and their families. We need to work so that no more children die from COVID-19.
Are you trying to share your screen, Valencia?
Yes, ma'am.
Would you like for me to share it for you?
Yes, ma'am.
Okay.
The latest clinical trial for a COVID-19 vaccine is happening right here in the Bay Area, and this time the focus is on younger teenagers.
It has really impacted their life just like it's impacted everyone else in the world. So it's very critical that we actually eventually develop the vaccines that can be administered to.
While drug giant Pfizer has now released the results of its adult vaccine trials, Kaiser Permanente has been testing the vaccine on 16 and 17-year-olds for several weeks now at locations in Sacramento and Santa Clara. Now the company and healthcare system want to expand the testing to include 12 to 15-year-olds too. 17-year-old Allison Eisenman, who lives in Santa Clara, says she decided to sign up and do it because she wants to be part of a solution.
Teenagers are probably one of the most irresponsible people during the pandemic. I want to do what I can to help get us out.
Both Allison's parents participated in the adult study too. Her mother is a nurse with Kaiser, and they're all members of the Kaiser Network, which is one of the requirements for participating in the study.
My parents had both already done it, and they only had like slight flu symptoms for a day. So I knew that that's probably the worst that would happen to me. I didn't feel like I was in any danger.
Someone needs to do it. There needs to be volunteers, and this is our chance to contribute.
Pfizer submitted an application to the FDA today for permission to start administering the COVID vaccine to certain groups, even as their studies are ongoing. Dr. Klein says this next Kaiser study will run for 2 years, and ideally they'll enroll about 100 participants in the 16 to 17-year-old age group and 100 in the 12 to 15-year-old group. In San Jose, Anusha Rasta, NBC Bay Area News.
A safe and effective vaccine may be the most effective way of ultimately ending this pandemic, but that's assuming that people will take it. Recent polls show some real concerns about the vaccine, despite the assurances from the scientific community about its safety. Will Carr has more.
As soon as April, the vaccine will be available to the entire general population.
With vaccine authorization expected soon, the biggest challenge moving forward may be injecting Americans with enough confidence to take the shots.
If we get vaccines to the American people and they don't take them, shame on us. Hey, I was already sick. I don't need it. Shame on us.
Many are wary of the vaccine's unprecedented speed. Others are polarized by politics. With the election now over, a recent Gallup poll found that even after nearly 250,000 Americans have died and many more have endured restrictions and shutdowns, 50% of the country still does not want to take the vaccine when it becomes available. That includes Irina Barlage, a physical trainer in Los Angeles.
I personally decided I'm definitely not going to take it.
No matter what, you're not going to take it.
No matter what. I believe I'm a healthy, strong person. It's relatively new. I'm in general a little skeptical about what I want to put in my body.
Barlage is not alone. She says most of her colleagues and clients feel the same way.
We honestly have a vaccine confidence problem in this country. We have huge parts of this population that just do not trust the manufacturers of vaccines. Even in a good year for the flu vaccine, we only see about half the population getting it. And the flu vaccine is a really well-studied vaccine that we know is incredibly safe.
The fear of the vaccine comes with the reality of rising COVID numbers. Cases are jumping across the country, including in Los Angeles County.
And much of the nation has been experiencing a significant increase in cases and hospitalizations.
Dr. Jeffrey Gunzenhauser, LA County's chief medical officer, says an effective vaccine could be the cornerstone to reopening many shuttered businesses.
Would you be willing to take the vaccine?
I would say I will do what I hope everyone does, and that is I will look at the information that's made available, And if it looks to me like it's safe and effective, I certainly would be glad to step up and get the vaccine and show people, as an example, hey, I'm getting the vaccine. But it is an emergency use authorization. It's not a fully approved biologic. So there is really that need for each individual to be fully informed about what it's for, the benefits, the cons, what's unknown about it, and realize they have a choice.
A safe and effective.
Since September 10th, nearly 555,000 people under the age of 20 have been diagnosed with COVID-19. Children are getting sick and children are dying from this virus. Let's jump right in. Before we talk about solutions, there was a quick poll taken earlier regarding how many of you would be willing to get vaccinated. The poll showed that 46% would take the vaccine and 56% would not take the vaccine. If you said you would not take the vaccine, would you like to share why?
I'll share. I'm just very, like one of the trainer in the video said, she's very skeptical about what she puts in her body. And the way that I was raised, I'm also very skeptical. And I feel like it's a very convenient time to have this glorious vaccine happen in the middle of like an election and all that. It seems very political to me because I like reading up on stuff like this. This is very interesting to me. So like, for example, I don't think I've ever taken a flu vaccine and I've never had the flu, but for me, I don't think it's something that I would choose to put in my body right now. Like if it's, let's say 2022 and the COVID-19 is still very, very relevant and very, very high, I would probably do it then. But right now, like being one of the first people, I would not do it because I don't know the side effects. I don't know what it's going to do to me in the future. So yeah.
Does anybody else would like to share that why they would not take the vaccine? We would love to hear your voices.
I'd like to share. Agreeing with what Akila said is, I think that because learning how like vaccines are made, they contain the virus itself inside of it, and I just don't believe that it's right to. I understand why they do it, but I just don't feel like getting the virus to heal me from like preventing me from getting the virus doesn't like feel right. And all like the virus just randomly happening. It's just like in the middle of an election. I just like feel like they just put the virus and put some other stuff together to make people and get people to get it so there wouldn't be more death. And I just think it just doesn't feel right to me.
Any of you would like to share?
I would like to share.
Would not take the virus.
For me, it's like there's not enough studies on what it like the long-term effects of it. It could work now, but what if later down in the future something actually happens because of the vaccine? That's why I wouldn't.
Shara, you. Oops.
I wouldn't get the virus because some of the things that the president has said about the vaccine, about the injecting bleach into people, and I just don't believe in the vaccine that he is on.
We would love to hear what some of the adults think about the COVID-19 vaccine and why they would not take it.
Yes, I can say something towards that. Hello?
Yes,
Hello?
sir.
Okay. Yeah, I think looking upon the history of vaccines, for instance, the polio, when that came out, thousands of kids were hindered by side effects from that. And I think it's like today, I think it's multifaceted. From an African-American perspective, it's due to history. History on how the medical field has done some disastrous things to African-Americans. And moving forward today, you have Black women pregnancies, survival rates, which are high. You have pain management, which is ignored, and things of that such. For myself, I don't think it's proven enough right now. And especially for my son, I would not want him to take it because there's too many unknowns. Until it's proven, and I'm thinking years possibly, there may be a possibility I may think about taking it. For instance, I've never taken a flu shot. I've just kept myself safe and washed my hands and things like that. That's been practiced even before COVID made its presence. But it's a personal decision that people have to make. But as right now, I'm following the science and I'm following the information, the facts, and the history. And right now, it's not a wise thing for myself to do.
Yeah, Ms. Gibson, I'd have to agree with that. Can you guys hear me okay?
Yes, sir, we can.
Yeah, and I've heard this multiple times. Keela mentioned it earlier, but I feel the same way. I mean, it's I've never had a flu shot, and I don't get the flu. You know, I've been out and about in multiple states around all kinds of different people, and haven't contracted the virus as of yet. I would be interested to see though if it has something to do with blood type, because I've heard some speculation on that. But you know, again, you hear about people that get the coronavirus, and one of the other folks had mentioned that they're, you know, injecting some of the virus in you. You hear about some of the side effects that some people have from having this virus. Some people have been losing their hair. You know, I know someone that had contracted the virus a while back, and they're going in and out intermediately of losing taste and smell, which is interesting because they don't have it anymore according to the test, because they've retaken the test multiple times, but they're still seeing those lingering side effects. So those are some things that I think that from a community standpoint, I think a lot of people are worried about that. You know, again, nobody wants to get this. Obviously, some people have been affected by it, but it's, you know, it's hard to say if it's, you know, going to be working like they say it's going to work. So again, very rushed to put through, but you know, obviously there was something desperately needed because there's a lot of people dying every day, and I get that. So.
Continuing, for anyone who said they would take the vaccine, would you like to explain why you would take the COVID-19 vaccine?
I would jump in here if someone else isn't. So I don't know that I want to go like this week as the vaccine's starting to come out. I'd like to watch a little bit more to see what is happening, but we have seen people in our lives who have struggled with COVID, and I just think, especially as I know a lot of people who are older, and my husband has had health issues, that is something that we would like to consider the vaccine when it does come out. I think that it's wise, though, to watch as more people are taking it first.
I'd like to say something. Yes, I definitely understand the concerns of people, but for someone who actually had the COVID virus myself, matter of fact, I was the number 4 person in Duval County. I almost died twice. In 4 days, I lost 17 pounds. I went from 190 to 171 in 4 days. And I remember talking to my wife in the hospital room and say, hey, get the insurance policy out. I don't think I'm gonna make it through the night. So for somebody who actually had it, who almost died, I would definitely take the vaccine. Thank you.
Anybody else who would want to take the vaccine?
Hi, I can jump in. I would say, my name is Madeline, by the way. I'm an AmeriCorps member, serving at the Player Center for Child Health this year. My sister lives in Salt Lake City, Utah, and she is a COVID vaccine or a COVID nurse. And she works in the ICU, and it's really been such an incredibly tough time for our healthcare workers, and I've really seen firsthand the impact that it's had on her, um, and just as well as other members of the community. And I also live with my grandparents, and they would be considered a part of the at-risk group for complications with COVID. And so, I feared that I would possibly give something to them because I am still working. So, I completely understand, all of like the nerves around the vaccine and everything. And there are definitely things that I've considered and thought about too, because it's hard not to. But I think that just at this time with everything that's, going on, and I've done a little bit of research about the vaccine myself and everything, I've kind of decided that it's worth it for me to do what I can to try and, protect my grandparents and, show support for my sister. So.
Can I say something? Ms. Gibson?
Yes, sir.
Okay, I agree with Ms. Smith, Ms. Madeline Smith, and I also agree with Councilmember Newby. I understand the concerns and the things that were raised by the other people who spoke. But one thing that kind of gives me some comfort is that there are about at least four different drug manufacturers who are working, I guess, independently: Moderna, Pfizer, Johnson & Johnson. So I think that if they're all working independently, trying to do the same goal, and I guess it just happened, everyone kind of came at the same time with the vaccine, I think that it should be pretty safe. But the way that we're going now, I don't think it's sustainable. The issue is that you don't want the hospitals to get backed up to the point where everyone's in the hospital at the same time. And if we want to get back to school, if we want to get to our workplaces, if we want to kind of live a normal life again, we're going to have to do something. So I don't think that the way we're living right now is sustainable more than another year or so. So I think that it is important, for people to begin taking it. And I think that as more people take it, and hopefully the side effects, if there aren't any, I think more and more people will feel more comfortable. But my opinion is I also think that we can live society is sustainable going at this rate. So
yeah. Can I say something again? And let's look at the numbers even here in Duval County. I remember in March 15th, I was the number 4 case. So I was the number 4th person to have it. So right now in December, 8 months later, we're gonna have over 40,000 people in Duval County that contract the virus. That is a outstanding number. So we definitely got to look at taking this vaccine, because you're going from 1 case in March to 40,000 in December. That is a staggering number.
May I say something in regards to past responses, please?
Yes,
Hello?
sir.
Yeah, I think.
Hello?
Hello. Can you hear me?
Can you hear
me? Valencia?
Yes, sir. We can hear you.
Okay.
Yep.
So I think a big part of this problem is people problems, because when we don't have a vaccine, some folks still can't do the basics. Some folks, I go out to the stores, there's no mask wearing. Also, there's been multiple reports of large gatherings, and some folks probably don't wash their hands and things like that. So before we use a crutch like a vaccine, people have to take the basic precautions, in which a lot of folks aren't. And the other thing is flu vaccines and other vaccines as far as I know. I'm not a doctor, so someone can correct me. But those flu vaccines and the other vaccines are built upon known strands. So if a flu vaccine goes to a person, that strand can change, which you're not vaccinated for, and you still catch it. Now, I'm not against healthcare workers and things like that. They've been doing a extraordinary job. But if folks just do the basics, it would kind of make their job easier, I think, in my opinion. And I think a proven vaccine, there needs to be more data. So that's my take on it.
Mr. Riggs, I'll say one more thing. Mr. Riggs, I agree with what you're saying. I definitely agree with what you're saying, but I don't think that as a society that we can trust for 100 or 250 million Americans to do the proper things, to socially distance, to stay inside, to do X, Y, and Z, to not go out to restaurants. Right now, we're in a situation where we're in COVID fatigue, I believe. I went to a restaurant last night just to get takeout, to pay for my food and to leave. And there were so many people in the restaurant, and you would never think that people were waiting outside. You wouldn't think there was a COVID virus. And I was like, okay, I was gonna get my food and go. I didn't think it was gonna be that big of a deal. I was scared just getting my food for takeout. So what I'm saying is that in a perfect world, yes, we could just socially distance, and the vaccine, technically, the virus technically would go away if we did what we're supposed to do for a year. But I don't think that that's really reasonable.
Can I add on to that? Personally, I feel like the COVID-19 vaccine was just really rushed, considering the fact that usually it can take years to develop a vaccine, and COVID has only been within the United States for not even a whole year yet. I feel like it's just extremely rushed, and I feel like there's other safety precautions that should have been taken from the start of the virus to prevent it from spreading as much as it could have. So I feel like to just rush a vaccine, I feel like people have the right to not want to really take it because they don't know what they're injecting to their body. And then the whole process is just extremely rushed, like I said.
I wanted to add on to what Mr. Riggs said. I feel that as a society, we are going to either want to take the vaccine or not, just like we either want to have a mask on or not. It's a simple fact of the human person. Like, people are stubborn. People are going to do what they want to do because it's a free country, whether we like it or not. But what I feel we should really look at is the countries that have had COVID and had everything, and now it's gone. Because I think America, I don't know for sure, but I think the U.S. is still one of the only countries with this many deaths and this many COVID cases. So I feel that we should look at other societies who have gotten rid of the virus and just try to see what they did to kind of reciprocate. Because at this point, we just need the virus gone to get back to our normal lives, to get people's jobs back, to get people to see family and different things to get back to our normal life.
Right now, we're kind of like backed up against a wall because we don't have that many options that we can do to solve the pandemic. So I feel like if you have an option to take the vaccine, then you should at least try it, because there are people dying and loved ones are dying and everybody around us is dying right now. So I feel like if you could contribute to at least trying to build up the data, because it seems like nobody wants to do it simply because it's too political. But if there is a chance that the vaccine can help you and can get rid of COVID and keep you healthy as a whole, then I feel like we should at least try.
Yeah, and if I may interject, I do agree with that. And I think that it is very rushed. And, that's something that I was nervous about too. But just after, talking with some people about it, I feel like I've kind of come to the conclusion that, the vaccine has had a fair amount of research, and it's based off of previous vaccine um, development techniques and things that have been used. So I mean, I know that it is, obviously it's still rushed and that's a problem, but I mean, just, someone mentioned this earlier. I think that, people aren't social distancing the way that they should. People aren't wearing masks in the way that they should. And, that is what a lot of other countries did to really get their numbers down. And I think that in the US, we have a real problem with people, thinking that, they're sort of immune or exempt from getting it. And, they think, that it's not going to be a problem for them. But, just because it's not a problem for one person doesn't mean it's not going to be a serious problem for somebody else. It can spread and go to someone who's immunocompromised. And, and I think that if we sort of our best shot at getting rid of COVID is a combination of the masks and social distancing, and then also the vaccine to really help reduce those numbers. And I think that, if we do have that option to take it, I think that we probably should. I think that it would be a good idea just to, I think it was Jordan was saying, if we have that option to reduce those numbers and give it a shot and do what we can, I think that we should try.
Yeah, this all sounds great, but I'm talking from a perspective. My wife had 4 relatives lived in New York, and all 4 died from March to April, less than a month. I've been in the military. I've taken a lot of shots. But the reality is, if someone was to take this vaccine in a family, who's going to be there when something devastating happens or long-term effects happens where they have to be supported medically and things like that? Reality, a lot of people are going to turn a blind eye to that. But the person who's close to that person is going to have to deal with that. And my fear is that this thing is rushed. No doubt about it. If you look at the facts, this thing is rushed, period. And like the young lady said, there's been countries that have done what should be done without the vaccine, and it's been eradicated in a sense. So my fear is that the public school system in Duval, worst case, may come to a conclusion at some point and say, hey, your kid has to take this vaccine in order to go to the school. And that I see is a big problem.
I'd like to add something. Okay.
Excuse, we really have to transition to our final part of this presentation. Like Jordan said, we really do not have any options. So we now get a chance for everyone to use their voices to develop solutions. Our task today is how can we work together to get children, teens, and adults more knowledgeable of and more comfortable with taking the COVID-19 vaccine.
May I say something, Valencia? Adults, this is really where the kids need you, because the reality of life is that even if you do or don't agree with whether or not the vaccine needs to be taken, the vaccine is here. It is here. And you've got to develop solutions as to how you're going to make sure that you get the most knowledge. As Valencia said, it's all about knowledge. What are we going to do? How are you going to come together? We need you now to come in and to help develop solutions. So what's the solution? You say you don't want to take it, but what's the solution to making sure that your voices are heard and that young people everywhere who do need to take it gets it, or if it's said that you got to have it. So I'm going to turn it back over to Valencia, but I just want you to know that your task today is to develop solutions. Solutions. We've heard the problems. Now it's solutions. On you, Valencia.
And for those who said that they would not take the vaccine, what would make you more comfortable with taking the vaccine? What would be a solution like running stress?
I think
Valencia, I'll go ahead and kind of speak on this. I think that, one thing is that, anytime something new like this comes out, you really need to hear from the people that created this. What's in it? Because people are always scared about, what are you putting into me? They need to talk about what they did and the steps they took to make this vaccine. How many people did they test it on? What were side effects? I mean, they need to get very specific information out to people. I think that's probably the scariest part, is that most people, they don't know that. They just know that there was a vaccine that was created in a very short amount of time in comparison to others. And that scares people off to start with right there, because they think that stuff was bypassed or sidestepped. But I think that really, if you want to make a difference, you're going to have to get the people that came out and created this virus, all of the different companies. Because I'm just curious myself, the one vaccine, I can't remember who made it, it's got to be stored at like negative 96 degrees. So is it being shot in your arm at negative 96 degrees? And like your body's at 98.6. So how does that mesh? I mean, I don't know. It's just, there's a lot of things like that, I think, that people think about, and they're just, fearful of those things. But I think communication from these companies to talk about the specifics on what they've done, how many people they've tested, what are the side effects, how many people got the side effects, is it age specific, or, as much detail as possible, because, without that right now, all we know is it's been marched through quick, and, somebody at the FDA's put a stamp on it saying it's good to go. And, whoever gets a negative side effect, sorry for you, but if it helps most of the people. So I think that's the problem right now, is that they're looking at it'll help most of the people, but what about the people that are going to have side effects? They need to know that stuff. So that's just my take on it anyway.
Okay. Thank you, Mr. Snyder. Okay. So mainly I would say that IMSTAR's point of view or look on it is that we have many solutions available. We have a main focus to look towards. As one of our main focuses or resources, Dr. Fauci is a main resource of the information during the COVID-19 pandemic. And it has been announced that he has told us that one of the leading scientists that has put together the vaccine is a Black woman. The information that is given to us is kind of like a shining star towards the ones that are kind of neglecting, for say in the African American community, that is kind of neglecting towards the way of taking the vaccine. I think an amazing resolution is to most definitely take the time to research and to get as much information possible out of the whole process, and really come together and think about yes or no, with that adding on information.
Yeah, thank you, Malachi, because that was very, very informative. I feel that one thing that will really make me want to take it is seeing the results and seeing what has come after, because we don't know how it's, because being a young African American woman, I don't know how it would affect me differently than some people. So I feel like when it's being tested, it should be able to test the scientists should test every single group of person, so that we know how it would affect this person differently, because COVID-19 did affect people of color differently than it affected other people. And just like Mr. Snyder said, it's a matter of testing, and just like Mr. Ray said, it's a matter of time. You have to give it a little bit more time, because it is a little rushed, but I want to see how it would affect me in the long run if I take it now.
Since the pandemic hit, it's been hard for everyone to live their normal day-to-day lives, at the same time trying to be safe and trying to wear your mask and staying 6 feet apart. And then you have other people not really believing that the virus is almost real, like they're in denial because they don't wear their masks. People are in restaurants, like we said earlier, it's packed everywhere, you're not wearing your mask right. So this virus is very, very serious. This is very much real. And I'm a star. We have platforms like at the beginning of the meeting today, how we went over the Empower Me app in the podcast. We can use those to spread information because we do have platforms. And if you have a platform, you need to use your voice right now because this is a time of need that we really need to be speaking out against this and putting out our opinions and voicing our opinions and making everybody known and letting everybody know what's going on and not leaving anybody in the dark because this is a matter of life and death. The podcast can be used to express how people who've had COVID or who've had family members who had COVID feels about the vaccine, and maybe those people can influence other people or our community to try and take the vaccine. If you don't want to, you don't have to. It might be required. We don't know. And then the YouTube channel can be used to spread good habits and spread any newfound knowledge that we know about the vaccine. That's my solution.
That's a great solution, Jordan. I'd love to hear some of the adults respond to that and how you can help the young people do that. Amistar does have those two platforms. They have their YouTube channel, they have their podcast channel, but how do they get it out? Is there anyone on this call, on this Zoom, who can help them get that out nationally? Their platform can only go so far because of where they are, but they need help. So is there anyone, any adult who can speak to what Jordan said?
So I'm the editor of the Times Union, but today that is owned by Gannett, which owns USA Today, that network. And I do think that what we're talking about is education here, right? That's what everyone's talked about. We all want to know more information. It's somewhat about an amount of time. Do we want to just know, you know, in my case, I feel like I don't need to know a ton. I don't need a ton of time so long as things are going early. But for some, you may feel like you need a lot more time. So that education, getting the information there and sharing information, especially I am loving hearing the point of view of youths, and I'm positive others would feel the same way. So I think that's something that we could continue that conversation to see if there's a way we could help get some of what you all are talking about to a larger audience. Locally, but again, nationally, because we have that network.
Thank you.
Okay, so right now, for some of the solutions that we came up with, we have that we should hear from the representatives of the COVID-19 vaccine and hear how they made it. We need to use our voices, use any type of platforms that we have to get our word out of what we think of the COVID-19 vaccine and ways that can get people to take the vaccine. Anyone else have any solutions?
You skipped the most important solution though, Valencia, and that was that Mary Kelly Parker talked about helping you to use your platform on the local and the national level.
And helping youth to use their platform on national and anyone else have any solutions that can add to that?
I like to add something. I think that we just have to do our due diligence. I mean, we got, I'm sure everybody has cable and you can watch CNN and MSNBC. And I think one of the solutions is that we have to understand and be more knowledgeable of what the situation is. You know, that Pfizer vaccine is the same one used in Great Britain, and it's the same one that's going to be used around the world. Mm-hmm. So I think we have to use our due diligence to observe and watch the news and understand and just watch and see what's going on in these other countries using those same vaccines that's going to be in our country. and then you just make your, you just make your decisions based off the science, as far as, not like, I think too much is political being done. So you have to use your judgment on what's right and what's wrong. And if it's working in that country, then if you feel confident, you just have to base it on the facts. And I know right now we live in a world of hysteria, and it's all of us scared. But I think that in order for us to be safe, you have to make the best decision for yourself and your family. And I think that comes with just being knowledgeable, listening and observing and just doing your due diligence to make sure this is the right thing. Because especially for African Americans, I mean, we have a history where we had they had the experiment in Tuskegee, and there's a lot of bad things been done, and we can't change that history. So I understand, from the young people to the old people, that we have to really, be cautious, because I'm 56 years old, and I don't want the virus, but I think we have to find out what a solution is, because I think what someone said in this discussion, that we can't continue to live the way we're living right now. I mean, we had Thanksgiving 2 weeks ago, and it was suggested not that we leave our homes and only have Thanksgiving meal with the people in our own homes. And I just think I think we just have to utilize, and I think the smartest solution is to make sure you observe what's going on in the world, not just America, and just see how this thing comes through over the next couple of months before you make a very knowledgeable decision on what you want to do.
And with our podcast too, since a lot of people don't believe what's being put on the news right now, people are very skeptical, and everybody has that right to be skeptical, because the way that this is happening, you have to make a right decision during this time. So with the podcast, I feel like, since we're coming from a more genuine background, they might believe us more than they believe the actual news. Because news companies, they can get paid off by someone just to lie, So if you have a group of teenagers telling you what they know and how they feel, I feel like it would be more genuine, and people would respect your opinion more, and people would really take into account or take into thought about what they should really be doing.
Yeah,
I think, I'm sorry. If I just add real quick, I think Jordan makes a really valid point. And again, I'm from the news, so, I get exactly what you're saying there. Have you all considered, because I think you have a lot of power behind what you're trying to do here. Have you considered if you might ask, like, the folks at UF Health Jacksonville or NAS Jax or any of these other hospitals that are going to start getting the vaccine, they're going to start with their doctors taking it first? Have you considered maybe you could be, journalist, essentially? You could have them on your podcast or YouTube channels and interview. I would imagine they would love to be able to talk to you directly and let you share then with your peers what you're finding. And you can ask, you can say what doesn't sound believable, what just, which doesn't ring true to you, and just ask in that really genuine way that you guys are asking and saying things right now. I would imagine they would be willing to have those conversations with you. It might be a way to, satisfy you, but then you be able to help others to understand it. Because if youth are still getting it and spreading it, it's affecting everyone. So do know that it's really important to everyone that, at all ages, people feel comfortable or understand what the risks are.
And I just want to go into what Mary Kelly Falker just said. And Jordan, you made an excellent point. And I love the way that that solution from you, I didn't think about that, but that is so good. And what I wanted to say was that especially since we're dealing with teenagers who have such a negative view right now of the vaccine. They will listen more to their peers than they would to anybody else. So Jordan, I'm really glad to see how you're trying to make sure that you advance that platform so that it can be used. And then Mary Kelly, thank you so much for bridging it so that there are so many different ways that they can do it. So,
and then even help promote it. Like we could be the ones to help get it out locally, but also help to get out. I mean, you could be having the conversation and we can help get it out to where others can hear what your findings are. It's
exactly.
I feel like what Jordan said was an amazing idea because, I mean, I'm going to tell you from experience, I would listen to my peers more than I listen to an old doctor who doesn't have the same perspective. So we have, as kids, sometimes we get underestimated, and sometimes people are like, well, maybe they don't know what they're talking about. And I feel like this podcast and this YouTube channel really just kind of helps that. And this platform that we're having, this conversation that we're having right here is very important because we get to see the adult's point of view from a genuine standpoint, and they get to see ours. So it's a purpose of point of view because people tend to get stuck on their one idea. They're like, oh no, this is right, and this is going to be right for the rest of my life. So I feel like that is really a really good point because whether we like it or not, we listen to our peers more than we listen to adults. Like if my mom says, do this, and I'm like, but my friend says, hey, yo, do this. I'm like, okay, I'm gonna do it. It's a different perspective.
Yeah, and I think going off of that, everyone has people in the community that they trust and that they listen to. And I think that having those conversations with role models and peers and, leaders within the community is so important because you guys have a voice that, can really be used for good and, used to disseminate, truthful information, non-biased information. And I think that's so important in today's day and age where everything is so political, so biased. It's hard to turn on the news and it's hard to listen to what's happening. And, to hear you turn on one news site and, they're saying one thing and then you go to another and they're saying something different. And, I think that it would be really great. There are some resources, like the CDC, the National Institute of Health and things like that are disseminating, information that's, just sort of facts. And I think that that's a really great resource that people can use and you guys can use as a tool. And as you guys talk to people, you can really change the minds of those role models and you guys really have, a great impact that you can make in the community. And just, like someone said before, it's something that everyone needs to just think about, in terms of, what's right for them and what's right for their family. But, just being able to have that information, that unbiased information that you can talk to people about and offer people and offer your peers, I think is really, really important. So.
I think another thing, in addition to all the great solutions, I'm gonna go quickly over problem and solution. Problem is COVID, obviously. The other problem is not enough data. Solution, I think, is in addition to everything else, is we have local government representatives. I think the kids could contact the politically involved, contact those representatives to force those local representatives to go to the medical experts and ask, what's the data that these companies came up with the virus, such as the testing circle. When you do a science project, you have to have a chart of data. In this case, who was tested? What comorbidities did they have? What was their race? What was their age? What are the side effects, which is a big thing. We don't know all that information. So I think for the podcast, if they could do that and have others do that and contact the representatives, even though this is not a political problem, but you could use political channels to try to solve this health issue. That's my comment.
Just to, add off of that, I think too, some of the information, about these trials and things have been released, but they haven't necessarily been put out in a palatable way for everyone to understand. So I have seen some things online, but, I have a background in biology, a college degree in biology. And so, it's a lot easier for me to understand than someone, who has a background in something else. And so I think that information, needs to be turned around and disseminated in a way that's palatable for everyone and that's very clear and easy to understand. And I think that like Mr. Riggs was saying, that's an opportunity to, have that information just be clearly and basically put, and that's great.
Okay, I say one thing. Ms. Smith said something really good because she said she has a background in science. And I was recently watching a television program or a news source, and they were describing how the virus or not the antibody, but the vaccine works. And it was really, really technical. And somebody like Ms. Smith here could understand how the RNA and all that kind of stuff replicates and the proteins. But the average kid or the average American's not going to understand all that. So I think that when the students send their message, I still think we should put a message of social distancing, wearing masks, staying away, because one fact is that you cannot catch the virus if you're not around somebody else. You cannot catch it. If you are by yourself, you're not going to catch it. So I think that if we continue to socially distance and do those things, then as more and more people take the vaccine, people can make a decision on themselves and say, well, these people who are taking the vaccine, aren't catching the virus. Then more and more people will feel comfortable after 6 months, a year later. But if we keep socially distancing and doing those things, we can mitigate those losses on that end. And then as more and more people get comfortable with taking the vaccine, and then we can get it on that end as well. And a lot of other countries, someone said their numbers are better, but a lot of countries are authoritarian governments where they are required to take it, or they're required. If you come outside your house, you get arrested. We have a free, we can do what we want. And that's kind of, even though that's a strength, that can kind of be a weakness as well. So those are a couple of points I think that when you put your information out there, those are some things to think about.
Yes, I think Mr. Atkins is absolutely right. And one of the things we can do, we can get the students who actually have been affected by it, if somebody in their family been affected by it, to talk about it. I remember my grandson told me him and his friend was getting ready to go actually to football practice, and his friend got in his car and he said, "Hey, wear your mask." And his friend told him, "I don't have a mask." So my grandson wouldn't let him get in his car because he said, "Hey, I know what this does. My grandfather was affected by that." So if you have students that actually have been affected by it or lost a parent or grandparent, I think that will really help for students to understand how great this thing really are.
These are some great and awesome solutions. To quickly recap, some of the solutions we came up with is to involve political channels to be more knowledgeable of the vaccine, to use our voices in all of our platforms for our voices. Also, try to get people to help to get our voices reached out on a national and local level. For example, the Times Union. These are some great solutions. May I ask one adult to volunteer to join me in sharing out the group solutions when everybody returns to the main room for the closing? Would any adult like to volunteer in sharing out the group solution?
I'm happy to help if you need someone.
Thank you so much. Mr. Riggs added that when we use a podcast platform, because I saw that mainly we was moving onto the podcast side to use critical thinking. Would you like to elaborate on that, Mr. Riggs?
Well, I know a podcast sometimes can be full of ideas, and it could be based on feelings, emotions. What I would like to add, since this is a public health crisis, I would hope that the kids in the podcast and others would use critical thinking when putting the information out. Meaning, the information you put out is going to should be informative. It should be absolute, and it should be based on data and facts. And when I say critical thinking, when you put all those together, you come out with a platform that is critical to folks who's listening to it, and they would take it seriously, and they would depend upon it, because you, like, I'm sure there's some Florida Times folks on here, representatives, your data has to be, it has to be valid. So I would think that if those tools are used, then your platform will grow, and your platform will be very informative, important to folks who listen to it.
Once again, I want to thank everybody, the adults and the students, out their amazing ideas in this COVID-19 vaccine breakout session.
I think that we have everybody returned back to the main room. I thought that that would be the better way for us to go to our next breakout sessions. If you enjoyed the session that you were in, can you put an emoji up, some kind of thumbs up, anything that you'd like to put in there? Great. And what we're going to do now is I'm going to relaunch I'm going to relaunch the rooms, and then you will be able to select your second breakout room. Now, keep in mind, I know that you all had some wonderful conversations. However, we do have to end this next session in actually 30 minutes so that we can go back to our main room. And if you would just give me 1 second, we'll be ready. If you want to be in the mental health room, if you want to be in mental health and mindfulness session, which was a great session, by the way, if you want to be in that session, when we have the breakout rooms, you need to just stay where you are. Don't click on anything. And then for those of you like before who were unable to, because of your app, move from room to room, then I will get you to where you need to be. I'm going to open all of the rooms again, and please feel free to select which rooms you would like to join. Remember, if you want to be in the mental health mindfulness, do not select a room. And to all of our facilitators, we only have 30 minutes in this session. So you gotta limit some of your discussion so that you can get more to the solutions. Is there anyone? We will be getting started in just a few moments. And Mr. Hank Rogers will be there to make sure that we can get everyone to where they need to be. Is there anyone on this platform who does not want to be in the mental health room? If you would just share your name, call your name out, I can move you to where you would like to be.
Ms. Bernie, can I go to the racial and equity group, please?
Okay, Akila, I will send you to racial equity.
Stuart Riggs, racial equity, please.
Okay, just one moment. Okay, 1 second, Mr. Riggs.
Can I go to the racial equity as well?
Just one moment. I need to get Mr. Riggs assigned first. Okay, who else? Who was the other person that asked to go to the racial equity?
Marsha.
Okay.
After that, I would also like to go to racial equity.
Jordan, I will send you over to racial equity.
Yeah.
Is there anyone else? Because we're getting ready to get started. Otherwise, we will all be in the mental health breakout room. Let's see, Mr. Dawkins, are you? Yes, you're here. Ms. Katrina Taylor, you're here. Is our, yes.
COVID-19.
Okay, just one moment. For some reason, Ms. Hicks is not showing me your name.
That's no problem. I can stay.
Okay, once we're done, once we start, I may be able to get you over there. Is there anyone else before we get started?
Should I stay in the same room? Am I just staying in this room? Okay.
Oh, no, you should go to COVID. Okay. Okay. Is there anyone else? All right. Hello, Councilwoman Morgan Danford. We will get started. So this is the mental health, and we will turn it over to our facilitator.
Good morning, and welcome to the session on mental health and mindfulness. My name is Kennedy Larkins. I am in the 8th grade, and I would also like to introduce my star colleague, Trinity Burney, who is in the 9th grade. I will now start sharing my screen. What is mental health? Mental health, defined by the World Health Organization, is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. Depression is on the rise for America's kids. The National Institute of Mental Health reports that about 3.2 million 12 to 17-year-olds have at least one major depressive episode within the past 12 months. That statistic should scare everyone that is on this Zoom meeting today. Now, what is driving these mental health episodes? Today, we will put our heads together to find solutions to these two driving forces behind teen mental health issues: the COVID-19 pandemic and bullying and suicide. Now we will watch two short videos.
I think that in some ways I'm like less optimistic considering how it's been progressing.
Quarantine has kind of been like an endless void of nothingness, doing nothing all the time.
I'm definitely doing better now than I was in the beginning of quarantine. I just felt really helpless about the whole situation, and I was upset and irritable all the time.
Earlier in quarantine, I had some pretty scary mental health stuff go down, and so that was pretty frightening, and now it's pretty much under control.
I think it's starting to feel more real now.
It's starting to feel normal, which is completely unbelievable because this is not a normal situation at all.
Every day's just blurring together because it's just nonstop, the same routine. And I just feel kind of trapped and kind of stressed.
It's insane that this is what's happening, that this is just where the world is at.
I've just been pretty sad, and I've been really lazy, and I've been pretty bored.
I'm doing less creative things than I was doing at the beginning. Because at the beginning I was sort of like, okay, I'm set, let's go. I'm ready to do these things to make me feel better. But now I'm kind of just chilling.
It's very hard to stay motivated, and it's incredibly easy to just get behind and to get distracted.
I'm getting way more work than I was, and my motivation is just at zero to do any of it.
Everything's pass fail, so no incentive to work really hard doing it.
I've been getting super behind on my schoolwork because I can't really focus in Zoom. Then I kind of feel like school isn't real or it doesn't count. So I get super behind on all my homework, and then I have so many assignments to do, and I'd just be super stressed out about it.
The hardest part about quarantine is not being able to see my friends because I really haven't seen them in a month and a half, which is really just crazy.
Weekends are getting very lonely.
I miss my friends a lot, but I found new ways to communicate with them, and I started talking to them more often.
Self-isolation, I feel like I'm going crazy inside of my own house.
A night of sorrow in Southern California. Friends and family mourning the loss of 13-year-old Rosalie Avila. The teen took her own life after being relentlessly bullied at school.
I woke up and there was screaming, and I had to find my daughter hanging in her room.
Rosalie left behind a letter apologizing, calling herself ugly and a loser. Suicide is now one of the leading causes of death among young people. Nearly 6,000 took their own lives in 2015. Child therapist Cheryl Ziegler says bullying is an epidemic.
What we're seeing is that this has a tremendous effect on the fragile, growing brain of a child.
It's particularly dire in Colorado, where teen suicides have doubled over the last 10 years.
It's a nightmare for any mother.
In Aurora, the parents of Ashanti Davis are heartbroken. They say their daughter took her own life after being bullied. She was just 10 years old.
We just want parents to know that you got to be in your children's life, because this is reality now. We got to bury our baby.
State Representative Daphne Michelson-Janae is one of several Colorado lawmakers exploring legislation to combat the problem.
This is a problem. It is real. It is an issue, and we have a responsibility as a community to stop it.
A plea for awareness to prevent another night like this. Steve Patterson, NBC News, Los Angeles.
Our agenda for today is as follows. We will talk for a few minutes about these two videos. Following our discussion, we will have a special guest who will share his thoughts with us. Finally, we will jump into creating solutions that can help America's teens with these mental health issues. What are your thoughts about the quarantine video? Do you think that kids' thoughts and actions should be ignored, or will they simply go away when the pandemic ends? Please open your mics and share.
It's not good to be at home by yourself because anything can happen and anything is possible. People might just be lazy, or they might not do nothing, or might get too bored. They might be depressed, or they maybe just feel lonely because they might feel like the walls are closing in on them because they're home all day by themselves doing nothing, not but being online, because they need to be away from the screen, be away from everything, and be active, because being active is better than just being on the screen all the time, being on the screen all day. They need to be free from the four walls closing on them so they can go outside and be a little active.
I would like to say that I feel like a lot of teens feel the same way, but a lot of people are ignoring how they feel. And honestly, people in dealing with school as well, people think it's okay and it's just normal. And not a lot of people or parents are understanding how their child feels. So it's kind of hard it's harder on teenagers and sometimes kids as well.
I just wanted to chime in. I came from the last session on race relations and criminal justice, and there was kind of like a little quietness at the end, a pause. And Mr. Warren said, he opened up and said, "How are you all feeling? I want to know, give me some feedback." So I really appreciated that from Mr. Travis Warren. The kids really opened up and talked about how they're feeling right now and how school is going and what their lives are like. So thank you.
Would you mind repeating the question?
I said, what were your thoughts on the quarantine video? And do you think that kids' thoughts and actions should be ignored, or will they simply go away when the pandemic ends?
So I think the video was impactful. I mean, I'm a father myself. My youngest daughter is a sophomore in high school. She's 15, and we've had her on Orange County calls it Launch Ed, but she's online, and she's expressed a desire to go back to the campus, whenever it's safe to do so. But early on this year during the quarantine, she broke down and started crying to me because she was like, I've been, here in the house, and the fact that her siblings, are not here. They're adults, so they're not living here, and so she's here by herself. And so I had to really, listen to what she was saying. So I don't think that, ignoring, what you all may be experiencing or what you may be feeling during this time is definitely not the way to do it. I think it's new for everyone to include parents. I mean, we're trying to balance, how do we manage, through this crisis as well. So, but I agree, it's definitely going to require dialogue from everybody, and as opposed to being disengaged.
Do you know anyone who has been bullied, or who has tried to commit suicide, or even committed suicide? Please share your thoughts. And can I get one adult and one kid to answer my questions?
Good afternoon. Yes, being a clinician, I've known multiple students that have completed suicide. I think oftentimes when we think about suicide, we often think about depression, we think about withdrawn, we think about all the negative connotations that's attached to suicide. And the student that I know that died from suicide was actually quite jovial. He was very outgoing, very personable, a class clown, as a matter of fact. And this student would not have been on my list of kids that I would have thought that would have taken their own life. So I think that we oftentimes as adults we forget about the internalizers. We know what externalizing behaviors are as it relates to suicide, such as depression, withdrawn, not wanting to go to school, all of those typical symptoms. But I think that we have to also make sure we pay attention to those students that are hard on themselves as it relates to academics and performance and things like that. Those babies that attend dedicated magnets, who are typically very hard on themselves academically, because those are the students that we really have to pay attention to as it relates to suicide symptoms, because suicide does not look the same. Suicide symptoms do not look the same in every child. As we know, mental illness does impact 1 in 5 people every single day. So if we look at the number of individuals that are on this call, we know that at least 5 of us on this call are impacted by some form of mental illness. At least 5, could be more. So it's actually quite common. So to know that the suicide, as the statistics stated in the video today, is the second leading cause of death among young people, that's a reality. And I think that that's something that we have to really begin to have the conversation around that we're really not having today. So I commend each of you guys for bringing the topic up about mental illness and about suicide, because it is very real.
And when I was in school the other day, we were just talking about mental illness and bullying and suicide in class, because it was our new topic we're on, since we're almost out in the new 9 weeks, and we were just talking about this. And we had to write something about it and tell my teacher, like, have you ever met anybody who did or anything about that? She told us, yeah, we had to talk about it and write about it and share it with the whole class. And she was really happy, and she was excited because this is a new topic that we're doing in class, because she's my health teacher.
Good.
Now I would like to introduce a special guest who will share a few minutes with you on this subject. Mr. Brian Dawkins, a Jacksonville native, a Raines High School graduate, a fierce member of the Philadelphia Eagles football team, and a member of the NFL Hall of Fame, is with us today. Let's give him a hand and welcome home to the platform as he shares his story and his impact program. Mr. Dawkins?
Mr. Dawkins, you're muted, sir.
My bad. I'm still getting used to the mute button. It is a pleasure for me to be in front of you. Congratulations to everybody who's chosen to be on this. There's other things you could be doing, but here you are, and we're talking about this. And this is so important, so important. I'm blessed to have been raised in Jacksonville. Yes, I said blessed. Blessed to have been raised in Jacksonville, Florida. Grew up on the north side of town, over by Yancey Park on Lim Turner. That's where I grew up. I'm blessed to have had some success in my life. And I've also had a ton of failures. And understanding that successes and failures are a part of this thing called life, we have to understand that in those moments of failure or setback or discomfort sometimes, that we don't make permanent decisions in those times. And so talking about mental health, first of all, the thing that I've come to understand, because I've gone through depression myself, I've gone through suicidal thoughts myself. When I was a rookie in the National Football League, you say a rookie in the National Football League, you had depression? Yes, I did, because of things that I was not talking about. I wasn't getting things out. I wasn't talking about my feelings. I wasn't getting things out of me that needed to come out of me to prevent the pressure from continuing to mount in my life. And so because of that, I've become an advocate of understanding mental health. First of all, when I say mental health, what comes to mind? Usually it's negative stuff. People usually talking about depression, anxiety, even suicide. No, those are mental illnesses. Mental health is what we all have. We all have mental health. Not everybody has a mental illness. I think Ms. Taylor just said that 1 in 5 will have a bout with it, but that doesn't mean everybody will. And so to be able to separate the two, to get rid of the stigma so that we can talk openly about our feelings. And I said this in the last session, that your feelings, though, your really deep inner feelings aren't supposed to be shared with everybody. They're supposed to be shared with specific individuals in your life that you can trust, who are not going to judge you. They're going to listen to you, and they're going to help you through what you're going through. They're going to help, hold the burden a little bit. They can hold some of the burden, like the song Lean On Me says, lean on me if you're not strong, and I'll be your friend. I'll help you carry on. So those friends will help you carry on. They'll help you be able to come up out of that dark place, that dark space. But creating habits in your life to help you is so important, extremely important. I don't have a lot of time. That's why I'm kind of rushing through some of these things, but I really want you to hear this. It is your mind that is made up that's going to help you or it's going to hurt you. A mind that's made up is going to help you or hurt you. What do I mean by that? Out of the abundance of the heart, the mouth speaks. And the word also says that as a man thinketh in his heart, so are they. As a person thinketh in their heart, so are they. So the way that you can constantly think about yourself will become your reality. So if you're getting bad reports, or you're getting bullied, or you're having tough situations in the neighborhood and people are calling you specific things, if you agree with them, that will become what you will become. You have to take back that thought about yourself. You have to understand that it's okay not to be okay. It is. It's as parents. Yeah, sometimes I'm not okay. Yeah, it's okay not to be okay. But when it prevents you from being the normal you, is when we need to get help. Is when we need to talk to other people to help us out. And that's what. And even if it's a professional, that's something that we do. We allow other people to come in to help us to get rid of those things or to help us understand those things. See, sometimes the first questions was about, is a teen's feelings worth listening to, or should we just move on past it, or will they disappear? I'm paraphrasing, obviously. No, your feelings are worth talking about. They're your feelings. They're worth being heard. And so as a parent, we are very open to our kids about understanding or listening to what they're going through, listening to some of the things that's happening in their lives, even before COVID. So parents, we have to make sure that we're there for our kids. But I would say this for the parents on the line, that when we take off and we fly, the flight attendant always tells us to put the mask on who first, right? The adult. And then you help the younger person or whomever it is that needs to be assisted. So make sure, parents, that you are using some of these things for yourself. So what I'm talking about is coping mechanisms. So the Brian Dawkins Impact Foundation, that's one of the things that we do. We provide these services to schools. We pay for them through Everfi for the school to become a part of the Brian Dawkins Impact Foundation's reach to help young adults with coping mechanisms, to understand mental health, to understand how to get help, where to get help, and then understand if your friends need to get help as well. So like I said, I know we don't have a lot of time. That's why I'm trying to rush through these things. But just understand this, you are worth the fight. The things that you see behind me, this Hall of Fame statue right here, and some of these other trophies, all of that stuff was in me when I was your age. I just didn't know it yet. So had I let the neighborhood that I saw, some of the people that I saw in the neighborhood, some of the trauma that I saw in the neighborhood, had I allowed those things to prevent me from seeing myself different. I saw myself different. I saw different things from me. And so that became my reality. And my reality, it just so happened to be things that I didn't even dream about. All right. So continue to push through, continue to know that you're loved. First of all, you're cared about, you're adored. Like I'm so proud of you being on these calls, talking about your feelings or listening to people talk about feelings. That's not a comfortable thing. So I thank you for coming on. And you all, again, you are worth the fight. I've lost friends to suicide. I've lost teammates to suicide. I've lost good friends who've kids have committed suicide. So yes, it's something that we can do to prevent these things, to help others to understand their worth. And again, you are worth it. You're worth the fight. Thank you.
Okay, now we will get to our solutions. How do we turn these negative issues into solutions? 3 ways that I'm a Star plans on doing helping with these solutions is practicing mindfulness, utilizing I'm a Star's YouTube channel and podcast channel, and utilizing our Empower Me app. I would also like for you to help us come up with 2 more solutions today.
Hi, I think that some type of parent forum would be great to educate the parents on what they can do to help their kids, because all parents don't know how to positively help their kids during this time, and to be great listeners. And also one additional thing is like for the kids who are doing Duval homeroom or doing some type of home learning, how parents can motivate those kids at home. Because now instead of the teachers motivating, the parents are the teachers, so they need to motivate their kids.
And I think peers help a lot. And I know that with COVID, even though kids are in school right now, it's been very difficult. So just having the lines of communication open with your friends, and if you, and I guess the kids, are you guys all on Instagram and all those kind of things? I don't know which one you guys are on now because they change so frequently, but encouraging words instead of hurtful words, especially when you're on social media. Thank you.
So absolutely. Go ahead, sweetheart. Go ahead, Kennedy.
Oh, and I would also like to say thank you to Mr. Dawkins. You are an inspiration to us.
Well, thank you. I wasn't done though. I was just listening, letting everybody else get in on some of the suggestions, because I know Miss Taylor has some powerful ones. So I'll go after Miss Taylor.
No problem. Thank you. I was going to say that, you know, of course, journaling is free. You can go get a journal from the dollar store, or you can just use paper in your notebook and journal. Another coping strategy or intervention you guys can use is definitely mindfulness. I believe in the power of mindfulness and meditation and deep breathing. I'm going to drop a resource for you guys in the chat. That's 30 days of mindfulness and meditation. That's free. And I see that there are some parents that are on the phone. Definitely every morning, you as a parent, feel free to open up the day in the morning with your child as it relates to doing a mindfulness activity, which only takes about 2 to 3 minutes for you to do. Research shows that practicing some form of mindfulness at least 2 to 3 days, 2 to 3 times a day, can make an overall impact on your mental wellness, which is very important. So mindfulness, journaling, listening to music. Also, YouTube can be your friend. Also, positive affirmations. I believe in the power of words. And so taking little sticky tabs and saying things like, I am beautiful, I am wonderful, I am intelligent, I am somebody. Using those positive affirmations and putting them as Post-its on your bedroom mirror, on your bathroom mirror, so you can speak life to yourself every single day. It's very important. I think as young people, those things that I just mentioned is free. They're free. YouTube is free. Journaling, you could just use paper, Post-its. It does not cost anything to improve your overall mental wellness. I think that as a young person and even as parents, we have to learn to make mental wellness a priority in our lives. That's the only way we're going to stump out stigma as it relates to mental illness and suicide. So it's very important that we have that open dialogue every single day with our children. As I stated in the other call when we were talking about mental illness is instead of asking your students closed-ended questions such as, how are you doing? They're going to say, fine, fine, okay. Ask open-ended questions. Instead of you asking them, how was your day? Fine, okay. Ask them, tell me about your day. So leave that open dialogue between a parent and the child so your child can be able to disclose if they are having a bad mental health day. And we all have a bad mental health day. That doesn't mean we have a mental illness, but we all have rough times in our lives. We need to improve our overall mental. So what I'll do, I'll drop that resource inside the chat. Parents feel duplicated. It's a mental 30 days of a positive, powerful resource for you all.
And what I was going to say, because I knew Ms. Taylor was going to say that, so I wanted to let her get that out, because that's powerful information to have. The things that I developed for myself, and what I'm telling you to go look at, is not something that you have to do verbatim. But what I did was, when I came up out of my depression, one of the things that the Lord put on my heart to do is come up with a schedule for myself, a goal for myself in the morning of how I'm going to carry myself throughout the day, how my energy is going to be, me thinking about what type of energy I want to bring to every room. I want to be a thermostat, not a thermometer. I don't want to change with the temperature in the room. I want to change the temperature of the room. So that was my mindset when I began that. So if you go to briandawkins.com, you'll see the blueprint challenge. And in that challenge, you'll see that I pray, read, and I meditate and journal every morning. Every morning. I've been doing that for years now, for many, many years now. So what it does is it helps me to get in a place that I can be where I am. First of all, mindfulness, I'm 100% where I am in that moment, so that I can then think of and envision the person that I'm going to be throughout the rest of that day. And that's a powerful thing. It's a very, very powerful thing to be able to do. But I'll let you check it out again. I know I don't have a lot of time. I don't want to spend too much time talking here, but it's very important for you to understand that you are worth this. You're worth coming up with different ways to doing things for yourself. Journaling, oh my goodness, journaling. I gave this example in the last one. I journaled some negative things about myself, my person, or whatever. I've either balled it up. Once you journal it, because you can put feelings on paper. You can put feelings on paper. You don't know what I'm talking about. If I write my wife a love letter right now, that's my feelings and emotions being put on paper. I can give it to her. So it's the same thing with negative emotions. I can put those negative doggone emotions on that paper, and I'll ball them up and throw them in the trash. I don't want them no more, right? That's another coping mechanism that you can use for yourself. So there's a lot of different ways, parents as well, that you can utilize these things to help you through life. Because if there's one thing that's consistent in life, is there's going to be change. If you're in a good spot, I'm not going to say wait for the other shoe to pass. No, I'm not, excuse the other shoe to fall. And I'm not saying like that. I'm not being pessimistic. I'm just saying that there's going to be ups and downs, ebbs and flows in this life, peaks and valleys. It is. The Bible tells storms come on the just and the unjust. Even if you're a great person, the storms will come upon you. So knowing how to cope in those times are not permanent. For this, there is a season. It's just as a season. But understanding how to cope during those times is a powerful thought. And then finally, for me, I would say this. Know this, that you can grow from victories and failures. You can grow from victories because you get more confident, right? Once you have that victory, you'll get confident that you can do things. Even when you fail, though, you can look at those failures and say, well, what did I do and what won't I do going forward to not allow that to be the case going forward? So you can actually learn. So I'm not the mistake that I made. I'm not that mistake. I can learn from the mistake, and then I'm wiser going forward to live my life. So again, there's other things that we can talk about. We just don't have the time. But again, you are worth this fight, and I'm so doggone proud of the fact that you're on here talking about your feelings.
Thank you so much. So those of you who are returning to the main room, you had an opportunity to hear from the one and only NFL Hall of Famer, Jacksonville native, William Raines Ichiban graduate, Mr. Brian Dawkins. You got an opportunity to hear from him. That was a powerful session. So now we are, one of the things that we teach the students in the Amastar Foundation is the concept of time. And right now, time has really gotten away from Mrs. Burney, and I don't want my students to strangle me when we get back to our next session, because we believe in starting on time and we believe in ending on time. So we are about, we need to see if we can add 10 minutes to our end time. Is there anyone, I hope that you will be able to stay with us so that we could end at 12:40 as opposed to 12:30. I would love for you to stay on. I know that if you have somewhere to go, I can understand that. We have a powerful person who is going to moderate this final session. And I'll turn it over right now to Akila. I think Akila, do you go first?
Yes, ma'am, I do.
Okay.
Oh, wait, my camera. Welcome back, and I really, really hope you enjoyed the breakout sessions. I know I did. They were all very informational, and I just want to say thank you to all the adults and the stars who led the conversations and just had fun talking about things that need to be said. Now, we are pleased to have Miss Shana Pinnock. I'm so sorry. Shauna. I don't know. Okay, I apologize. She is the social media director at The Griot. Miss Pinnock is a creator of content for Forest and By U.S. I Am a Star is honored that she will convene the panel to discuss solutions. Give a round of applause, a virtual round of applause for Miss Pinnock as she begins her session.
Well, thank you, Akila, which I love because that's my middle name.
Really?
Yes, and it's actually Pinnock. You don't have to. Yeah, so my name is Shauna Pinnock. I am the social media director, as Akila so lovely, said, for thegriot.com. We are a Black-owned news and entertainment website. We are owned by our CEO, Byron Allen, and we'll actually be turning into, or rather entering into people's homes via television screens. We'll be launching Griot.tv across several television networks in January, right on MLK weekend, I believe January 15th. So super excited to be here with you guys. Just a little bit about me. I am a Spelman College graduate. I'm a member of Delta Sigma Theta Sorority Incorporated. And I think all of those experiences, as well as working for this super Black company that I'm currently working for, has kind of helped to equip me with a lot of information around these topics that you all have discussed and how it impacts, especially like Black and Brown communities. So I just wanted to say I'm so incredibly honored to be here. Thank you, Ms. Carla, for inviting me, one. And two, I'm so proud of all of you young adults, as Mr. Dawkins called you all earlier. I think these conversations are amazing. And I'm just so proud to see the youth actually almost making sense a little bit more than adults, to be quite honest with you. So yeah, let's get started. So we had 4 breakout sessions. I believe all of the topics were climate, the COVID vaccine, mental health, and criminal justice. And so we're gonna start, you know what? We're going to start alphabetically. So let's go with the climate room. Can you guys tell me, one of the representatives, what were the solutions that you guys came up with, and a little bit about the dialogue that were happening in those sessions?
Hello. We had, well, my name is Journey Butler, and I'm a representative for the climate change group, and we had a great session, 2 great sessions, and some of the solutions that we came up with were offering incentives to not only manufacturers of products, but also like the manufacturers of products that are not sustainable to make them sustainable, or using biodegradable packaging in order to save our planet, because climate change is a very large issue, and there are many things that happen with climate change that will affect us, not only us, but our posterity. And it's a very urgent issue, and that leads into our next solution, which would be creating a sense of urgency around climate change, because it seems like an issue that's not going to happen for a long time, or it seems like something that we shouldn't worry about because it's not going to happen for a long time. But it's projected that we will start to see many of the effects. We have already began to see them, as you've seen with the California forest fires, the Australia forest fires, the forest fires in the Amazon. You see that a lot of these fires are taking longer to put out than they would have in the past, because our climate is already getting drier due to global warming. And so we have to create a sense of urgency. As we've seen, there's quite a bit of people on the Zoom, and the turnout for the climate change is lower than we thought because people don't believe that it's a problem. So it's a problem, but we don't think that it's going to affect us. So we can just worry about it later. So we essentially have to scare people into thinking like, oh, hey, this is something that we should worry about. So that's one of our solutions. And the average American plate is made out of protein, starch, and, a few vegetables. And one of the problems with climate change is that farming livestock. So if we can find more sustainable options for, people to use or eat instead of livestock, like many vegan restaurants are popping up and many plant-based options are popping up. So just changing like the narrative surrounding food and the sustainability of farming livestock. So those were our solutions. Thank you.
That was really great. So I have a question for you. And really it's anyone who was in that room or anyone who would like to participate. So you said in terms of a sense of urgency, and I definitely agree on that end. And I would even go so far as to say it always starts at the top, right? It's about leadership. And unfortunately, for at least the last 4 years, we haven't had leadership that, quite frankly, believes in science, right? And believes in things like climate change. I would ask of the youths in the group and on this call, or, how would you express that sense of urgency to us adults? Because, it's, in my opinion, it's one of those things like, yeah, it's a lot easier to not care about climate change if you're 85 because you might not be here for a while, like much longer. So how do you guys suggest that we, or that you guys are galvanizing the elders? Unfortunately, I'm part of that group, I realize, but how do you guys suggest that you are galvanizing the elders to, care and really try to make sure that we are doing our part as grown adults, with power and with agency and with resources to make sure that this planet is better for you guys and the generations that come after you all? And anybody's free to answer.
So I feel like we can appeal to, I don't know if you guys know, but the presidential elect's pick to focus on climate change was John Kerry. And one of the solutions that came up would be forming a task force, a youth task force, to go in, like to coordinate with him and to create a youth aspect of it, because like you said, we're going to be the ones that have to deal with it. And by the time we're adults, we're going to really start seeing the effects of climate change. So it's easy to count us out now as, youth. It's easy to say, oh, they're children, they don't know what they're talking about, or, oh, somebody has to, be writing their speeches, or somebody has to be behind what they're saying. But I think if we present our solutions, not only our solutions, but we know what we're talking about and we believe in what we're talking about, we can, hopefully that shows through, and we can show that this is something that's actually happening, and you can see it happening all around, and it's something that we have to deal with.
Anybody else, or can I move on to the next one?
Because of time, we have to move on to the next one.
All right, well, here we are. So the next topic would be the COVID vaccine. Can I get one of the reps?
Hello, everybody. My name is Valencia Gibson. I was the facilitator for the COVID-19 vaccine breakout session, and Ms. Kelly actually volunteered to help me share out the solutions that we came up as a group.
I'm here with you, Valencia. Do you want to start, and then I can kind of talk about how we were talking about promoting?
Yes, ma'am. Some of the solutions that we came up with was to get more knowledgeable of the vaccine was to use political channels.
It appears that Valencia is having some problems with her audio.
We also discussed that we should try to use.
Valencia, it appears that you're having some trouble with your audio. We'll let Miss Mary Kay Parker speak for you.
Okay, and she took all of the notes. She's been doing a great job with all of this, but so there were a lot of people who were skeptical about COVID and about the vaccine. And it was a mix of ages. So we had some youth on, and we had some people who were older who all had concerns. Many had concerns. And so a lot of this was about education and about transparency, about hearing from people who had experienced themselves or had a loved one experience COVID. So like the council member Newby was on, and I thought his conversation was really powerful. So making sure that more youth could hear from people like the council member, but also potentially using the podcast and the YouTube channels that the I'm a Star already has established to get the word out and educate people and let them be the voices of the students talking to, we were thinking the experts, asking people from UF Health Jacksonville, NAS Jax, Baptist, any of the local experts that we could, that people already experiencing the vaccine, because they'll start getting it this week and start getting shots, and letting the students ask for themselves and see if they might be able to then share that, because the thought was that most people will believe their peers more than they're going to believe the mainstream media, including local media. So we thought that that was something that at a local level, the Times Union would be able to help share what they produce as they're doing this, and these conversations, be a part of those locally, and then also through our network of USA Today, Gannett, and see if we can get that out there.
Awesome. Okay, so I'm going to take this in a little bit of a different direction. The majority of us in this room are Black and brown folks. And so one of my questions would be, especially if you're kind of doing your own like poll of Black folks in terms of, who's willing to take this vaccine, and especially given I want to make sure I frame this the right way, because we need to be very clear that the onus of the mistrust of the medical community is not on Black and brown people. It is on the medical community. So given things like the Tuskegee experiments, given things like Henrietta Lacks, how do we, from the youth to the adults in this situation, and especially those of us within the Black and brown communities, how do we, I guess, help to, kind of get past that mistrust that a lot of us have of the medical community? What are the kind of solutions that we can slowly walk towards to get to the place where more of us do feel comfortable taking this vaccine?
And Valencia might want to jump in here as well, but that was absolutely part of the conversation that we had. Massive distrust. The poll showed the majority of the people didn't want to take the vaccine right away because of that. And so, including from people who had that lack of trust, there was conversations about more data, more transparency, more education. It was learning. It was education and being able to learn for ourselves and hear for ourselves as people are starting to take it, but also hearing from the distributors, the people who are actually making the vaccine. It was all about education is what I would say the big thing was. And again, I don't know if Valencia is back on here. Love to let her be able to add her voice again to this.
In our group, I know that Malachi White actually shared some information about how, I don't know if this helps, but about how a Black woman, I forgot her name, helped, was one of the people who helped with the vaccine. So to me, that's Henrietta Lacks.
Henrietta.
Henrietta Lacks.
Yeah.
And for me, that's a little bit more reassuring. But like Miss Kelly said, I still would like to see some data on the side effects for when African Americans took it, and how the side effects or the result of the vaccine was different from when others took it. Because I know Jordan, I believe, or Akila had said that the effects from when some African Americans had took it were different from when others took it. And Miss Carla actually put the link to the article inside the chat, and her name is Dr. Kismika Corbett. Sorry if I messed up that name, which I know I probably did. So yeah, we definitely need to see more data on it, but to know that a Black woman actually had something to do with the vaccine is a little bit more reassuring.
Awesome. Yes. And I think that's a really great start. I'll actually even drop in the link just this past week for the grill. We put up an Instagram post that was basically like, we get all the issues around the possibilities of taking this vaccine or the skepticism of it. But, I think what's the most important thing is that, as you guys said, that we get as educated as possible, understanding that there is time to wait and see. We're likely not on in that first round of this vaccine. And ultimately, we want to make sure that even though, we're learning and we're getting all this information kind of as it comes, this is a new virus, the vaccine is even newer, making sure that we're not spreading misinformation. I think that's a big thing. No conspiracy theories. 5G is not causing coronavirus, and making sure that we are able to kind of stop that in its tracks. And I think that's really just the first start. So thank you guys for even having that conversation. That's amazing. All right, now this one was a pretty heavy one. We're gonna get into the criminal justice conversation. Can I get the rep for that group, please?
Can everybody hear me?
Mm-hmm. Hi, Milton.
So I'm a Milton person. I was the representative for the Racial Equality and Police Relations group. And in my first session, I have me, Mr. Travis Warren, agreed that he would share our solutions for our group. So, Mr. Travis Warren, can you please come on and share?
Thank you, Milton. Good afternoon, everyone. So we had a spirited discussion, positive discussion during our session, and some of the solutions that we proposed included bias training for law enforcement, as well as sensitivity training, and then community policing, And one of our adults that were on, that was in that session, also talked about some of the work that's being done in Jacksonville as it relates to the school resource officers and mentorship with some of the students there, as well as broadly speaking, having adults, parents, having in-depth conversations with their children as well.
Awesome. Yes.
And one thing I want to add from my second group that my first group, I don't believe that we said, was diversity in the police department. That they want to have different faces in the police department, and those who are from that community go into the go to where they're used to be. And also they want to have police officers go introduce themselves to those people in the community that they're patrolling in a budget change, as in taking the percentage that the police get from all these different cities and states, which is a lot of the state's budget. The police, it goes to the police, and they want to take some of that money to go to training and other important issues.
Awesome. So again, I told you guys about my security alarm system situation, so please excuse any noises that you may hear in the background. But I think this was an especially important conversation considering, as we're in a time of critical racial and injustices and, just overall cries for Black Lives Matter. I would say in terms of the youth, what do you guys think? Because I actually was in the second session and one of the students said something that kind of hit me a little bit and kind of hurt a little bit was, why do the police need more training? Which, they're already trained in how to de-escalate situations and, if that training isn't working, then what's the purpose of more training? I guess my question would be, what would be those alternatives? Like I personally in the group, I had said, one of the issues that I've found in my conversations with police officers have been that they're not trained to de-escalate. They're not trained to deal with people in mental illness and mental health crises. They are trained to how to cover their own butts if things go awry. We've seen even situations like with just recently Casey Goodson Jr., a 23-year-old Black man in, I believe, Ohio, an open carry state, which the police were there looking for a fugitive. That it was an unsuccessful search for that fugitive. And somehow, some way, according to the police, they're saying Casey was waving a gun around, which is crazy, but even if he was, Ohio is an open carry state, and his family is disputing that. I guess what would we say, like, what's the exact training changes that need to be made? And how do we as just regular citizens help? And I mean, the onus really isn't on us, but how do we, as well as the police departments, how do we build back that trust, especially within Black and Brown communities?
An important thing that both groups hit on was to build that relationship between the police and those in the community. Training wise, they, as you said, that they weren't ever trained on how to de-escalate situations. They were just trained to cover themselves. Well, then the money from the funding that they get, you would take that and give them that type of training on how to de-escalate situations or how to notify or tell if a person has mental health issues. That way, when you give them that new type of training, then there's no training they can use to cover their butts. If they did wrong, then they did wrong. So that's what we can do, or we can push for people to do, is to give them that mental health training and really have them out there meeting the people in their community and getting to know them.
Definitely, I agree. And I think I formulated an answer to my own question, the secondary part of how do we build back that trust? And ultimately that's via accountability. it's very hard to see these injustices happen and then police have immunity to just keep on walking, or here they are, desk duty and still collecting a check while we're burying our own. So, and finally, another really super important group and discussion was the mental health group. Can I get the rep for that, please?
Yes, I am the rep for the mental health group. My name is Kennedy Larkins, and because of time, I'm just going to share our top 2 solutions. One was to journal our thoughts, and the other solution was to talk to someone that was close to us, to really help us, and someone that wouldn't judge us either.
Definitely. So I have a question, and I'm hoping all of our youths can talk about this, because I know, especially for some of us adults, whether we are parents or not, we definitely have children and young people who we love and care about, especially when it comes to this pandemic, when it comes to bullying. Unfortunately, a lot of you guys aren't really forthcoming when something is going down. And I understand. It's been a long time since I was your age, but I still remember it. I didn't want to tell my mom or dad if something was going on in the school, because I don't need them coming up and showing out and embarrassing me further or making the situation worse. So I guess one of the parents in one of the sessions, I believe the first mental health session, asked, how do we as adults, how do we help you guys? Because honestly, some of you are not very forthcoming with what's happening. What do you need from us to, I guess, be able to open up and let us know when you need help, whether that is, hey, we need to step in because someone is bullying you guys in whatever realm, or this pandemic is terrible and it sucks and it and it's impacting everything from our social lives to our grades. What can we as adults do to help you guys?
Well, I had 2 great resources, Mr. Dawkins and someone from DCPS. I can't really remember her name, but we can, as them being like at a higher level, they can help us by letting us know that, one, they are there for us and that they want the best for us, and we just really want to know that you're there and can support us through the hard times. Like everyone has said, the pandemic is hard on the adults, but as children, it is even harder on us to cope with this situation that we were kind of forced into. So honestly, we just really want to know that you're there for us.
Awesome. And that was the DCPS director, Rena Taylor. Yeah, so thank you. And yeah, I believe that is the end of my little bit here. I just wanted to say again, amazing conversations. I'm so proud of you guys. You give me so much hope for the future. The kids are going to be all right. I love it. And so thank you. And thank you for having me.
Thank you. Let's all give Ms. Pinnock a round of applause. I love the griot. Thank you so much. And now we will turn it back over to, I believe, Jordan.
On behalf of Akila and all of our STAR student leaders, I would like to thank you for taking the time to collaborate with us to help our generation unleash its greatness. City Councilwoman Joyce Morgan Danford will give remarks followed by closing remarks from our founder and executive director, Betty Seabrook Burney.
Thank you so much, Jordan. I appreciate that introduction. And thank you to each one of you who have participated today. This has been amazing. And I just have to do a shameless plug for my colleague, Councilmember Sam Newby, as well as myself and the other council members. The 4 issues that you talked about today are all issues your city council members are dealing with every day. In fact, two of these committees, the racial inequality and the climate change, I personally serve on those and serve as a committee chair. On the COVID, I serve on a state committee, and on the mental health, I'm just very, very involved in that because of the aspects that it has when it comes to policing. So you all need to give yourselves a huge round of applause for tackling the issues that City Council is tackling right now. So congratulations to each of you. Betty Burney, enough cannot be said about what you do with these young people and all of the people that volunteer with you and help you out. You have had some amazing speakers today. Miss Taylor, Miss Pinnock, Brian Dawkins. Oh my gosh, Brian, look at you, this grown man now who is doing his own thing. And when he was coming up, we were all watching him, and look at where he is today. That's what I see for all of these young people that you have involved with you. Miss Burney, you know it. You have the stars. I'm a star that's it. That is exactly what they are. They are all stars. So I just want to commend you again. Thank each one of you for being here. I'm like Miss Pinnock said, we know that our way of life is in good hands with these young people, because you guys are amazing. You've done some things in the past, and you're going to continue to grow and do more things. So congratulations to each of you. I want to wish each of you a very Merry Christmas and Happy New Year. And and Miss Mary Kelly, thank you for coming. So glad to see you. Absolutely having her. You know, she's one of those who's been around Jacksonville with the Florida Times Union and done some amazing things. Again, you guys have the cream of the crop. You are the cream of the crop. Blessings to you. Everybody be safe, though. Y'all were talking about COVID. I want you to be safe out there. Have fun, but definitely be safe. Thank you all so much. Glad to be here and close it out for you. And on behalf of City Council Vice President Sam Newby, we're always, always so pleased to be here with you, Miss Burney.
Thank you so much, Councilwoman Joyce Morgan Danford. Before I give my final remarks, we do have a national leader on the platform with us and a state leader on the platform with us, both of whom have been extremely supportive of the I'm a Star Foundation. So I'd like to start at the state level and have State Representative Tracy Davis, if you could just give us a quick greeting.
Hi everyone. Let me put my video on so everyone can see me, and I will definitely make sure that it's quick. To Betty Burney, this was amazing. I was had to be in two places at one time, but there is no way when Ms. Burney calls that you don't get local leaders, as you can see, state leaders, as well as local national leaders participating in anything that the I'm a Star Foundation is doing, because these students are, just like it's been said over and over again, absolutely amazing. Thank you to all of the adult participants. I've been listening for quite some time that joined the call or whatever, but I can't reiterate any more what Councilwoman Morgan just said, as far as these are the issues that we're working on locally, but we are also working on these same issues that these young people are talking about with such brilliance on the state level as well as the national level. So today it was all about the voices of the young people, the voices of our young adults being heard. It was simply amazing. I just want to share with you all that some of the things I heard as far as climate change, COVID-19 and some of the solutions, racial equality especially, and mental health, you guys have given me information and ideas to put together legislation to take to Tallahassee. So there was no reason I was not going to find some time to be a part of this today, because I knew I was going to walk away with some great information. Again, wonderful, wonderful leadership summit. If invited, I will absolutely return each and every year. But again, young adults, you are the voices of our future, and you did an amazing job today. And again, thank you to all the adults that participated. Thank you, Ms. Burney.
Thank you, State Representative Davis. You know I love you. And then we have Mr. Chris Miller, who is in the office of Congressman John Rutherford. Mr. Miller. And then following that, we will close after that.
Hi, everyone. I just wanted to thank everyone for the part they played in this wonderful event today. And as always, anytime, just as Tracy Davis said, anytime Betty Burney calls, I will be there, or the congressman will be there. One of us will be involved, because we really believe in what you're doing and your leadership and all of these wonderful, amazing students, and what a difference it makes to bring them all together to openly have these discussions that the local, state, and national elected officials, as well as all the other adults who have a very strong interest in their success, we need to hear what their concerns are, and we need to listen more than we talk. And that's one of the things that your program does so well, is not only listening to them, but also hearing what their perspectives are and their solutions. And you've offered up some wonderful solutions, and we're listening as well. And we're not only listening, but we're working with, Congressman Rutherford is working with the state and the local representatives to make sure we're collaborating and seeing ways that we can work together and find ways to incorporate the students' solutions into legislation and into law. And one example is the 2018 Stop School Violence Act that Congressman Rutherford had passed through the House, the Senate, and signed into law by the president. And Duval County Schools has taken advantage of, I believe, $500,000 to help with issues like mental health, and helping identify and work together with the mental health community, as well as with the education folks and the law enforcement, and having them all work together to try to minimize the likelihood of these school violence events from happening again. And Congressman Rutherford worked with the Sandy Hook Promise Group, with the students, with the parents, with the teachers, and got a lot of input from Jacksonville as well. So that's just one example of why I'm a Star Foundation efforts are so important. And thank you again, Ms. Burney, for continuing to lead the way, to shine a light on all these concerns, and to shine a light on these stars that are your students, that mentor each other and help each other. I just ask that they never stop speaking up. Always speak up. We need to hear their voices, and we need to help them with the very real concerns and challenges that they have as young adults in today's time. So I just encourage you to keep that happening in any way that Congressman Rutherford in our office can help, can be there to listen, to be there to support you all. I promise you we will do that. So thank you again for allowing me this blessing of representing Congressman Rutherford and joining you all today.
Thank you so much, Mr. Miller, and please give our regards to Congressman Rutherford. I would be remiss, and I know that I don't know if Superintendent Green is still on the call, but if she is, you just have to say hello. You know I always have to call on you. So if you're still here, please just say hello. I know that she probably has so many things to do, but the fact that she continues to come and support us is means so much to our students. Are you still on, Superintendent Diana Green? Okay, she probably had to leave. So I will first like to say thank you to everyone that's on this call today. The students in the I'm a Star Foundation, you know you are my babies, you are my stars, you are my smart, talented, and resilient students who are destined to change the world. My world-changing leaders are going to do some great things. And then to have these adults, there were parents on the line, there were local, state, and national leaders on the line. There are people who are listening in on YouTube. Just to know, for our students to know that you have all of that support is going to mean so much. The support from the Griot, the support from the Florida Times Union, the support from Duval County Public Schools, All of that means so very much. I want to take a moment though to highlight Kennedy Larkins. And Kennedy, for most of you who don't know, these students are literally in 6th, 7th, 8th, 9th, 10th, 11th, and 12th grade. They are babies compared to what you think of when somebody is convening a group. But Kennedy is in 8th grade, and Kennedy was selected to be the co-chair. She's the one that put all of this together. And I have to give kudos to Kennedy because although she's in 8th grade, she has the mind of a 70-year-old seasoned woman. And there would be times when I'm moving back and forth because we're online now, we're doing everything virtually. So if I'm having to move back and forth, I'd come back to her and I'd say, Kennedy, you guys need to develop your 4 topics. They develop them. She'd say, already got it, Miss Bernie. And then I'd say, Kennedy, there are some new students coming in. You need to share and explain with them what we're doing. Already did that, Miss Bernie. She's just a rock, but she is just an example of what all of these students are. They are stars, smart, talented, and resilient students. I'd like to thank our all of you for coming. You will get a special note from me. There will be a COVID-19 vaccine conversation that takes place in the next week or so. We'll share that information with you. And for me, I like to leave it up to my students. So my closer, I have one young man, he's in 6th grade. He's been hanging around I'm a Star since he was actually in 4th grade because his sister was in. So he was our mascot. Maybe he was even younger than that, but he's my closer. So I'm going to turn it over to Miles McLaughlin, who will close for us. And I'd just like to thank you again. Happy holidays, Merry Christmas, and blessings to all of you. Brian Dawkins, love you much. Miles.
Thank you, Ms. Bernie, for that beautiful introduction. And hi, my name is Miles McLaughlin, and I just want to let you guys know that we are stars, smart, talented, and resilient students. We are middle school and high school students who want to make a difference. We are America's children who want our voices heard. We are leaders who want to serve. We are grateful that we have adult leaders like you on this Zoom platform who are in our corner to support us. Thank you for your service. Thank you for your voice. And above all, thank you for your leadership. And I hope you all have great and happy holidays.
Thank you, Miles. Would all the stars please remain on the session? Everybody else, have a wonderful day. All of my star students, please remain on before we end the session.
Thank you all. Have a wonderful weekend.
Thank you all. God bless.
God bless.
Great job, guys. Great job.
Yes, phenomenal job.
Thank you, Ms. Taylor.
Thank you. It's been truly an honor. Let me know anytime you need me.
All right.
Thank you, Ms. Taylor.
Thank you, guys. You are great. I love you guys.
All right, let's see. Thank you. Thank you, thank you, thank you. My babies, I hope that you are proud of yourselves because I am darn sure proud of you. You guys did an amazing job. You were phenomenal. You were professional. You did everything that you were supposed to do. You looked good. You did great. Facilitators, give yourselves a hand. Give those facilitators, oh my goodness, just a great job. You guys were wonderful. Mr. Rogers, I know that you're still on, and I would just like for you as an observer to just please share with us what your thoughts were. Share with the kids what your thoughts were.